So good morning, everyone. Thank you for joining us for the final session of ShotSmart's 2022 Immunization Conference. We've had a wonderful and really informative week, and I'm really looking forward to today. So first off, I want to thank some of our immunization partners. And you've seen all these partners. They've been with us for a really long time, so thank you to them. I'd like to go through some housekeeping items. This call is being recorded. If you disagree, you may disconnect now. Slides and recordings will be posted on our website after the conference. Please make sure you're muted unless you are asking a question. To ask a question, please raise your hand and Megan will call your name for you to ask your question. When your question is complete, please remember to put down your hand. You may also submit a question into the chat box and I'll read those out at the end of the session. Also, please consider keeping your camera off unless you're speaking so we can make sure the bandwidth keeps the presentation and all of our voices nice and clear. And now I'd like to give it over to our first speaker of the day, IIP's own Vaccine Operations Manager, Tamery Olson.
Thank you, Marin. Good morning. This is Tamery. Welcome to not only our very last day of ShotSmarts, it is also Friday morning. I hope where you are in Idaho, the sun is shining. It's beautiful here today in the Boise area. And just wanted to say happy Earth Day. So thank you all for joining us this morning. So I want to start out just by reminding you a little bit about the different sections of the Idaho Immunization Program. So we have 4 separate sections of the program who function together to meet the goals of getting kids vaccinated in Idaho. That's basically what it boils down to. And now adults. We have a stronger focus on adults and what is happening out there in Idaho. So today I just wanted to talk to you a little bit more about the vaccine section of the program. And then in just a little bit, Gwen Baker is going to give you some updates and some additional information about IRIS today. So the vaccine section of the program is also broken down into 4 separate parts now. So this is a little bit new. We have a different structure that we have been working on, thank you to COVID, which we know has changed a lot of the things we do or the practices we have in place or what our focus is sometimes from day to day. But we have our good old stable Vaccines for Children program that is providing vaccines for those kids who are 0 through 18 years of age. We now also have the CDC's COVID vaccination program, which is doing just that, providing the COVID vaccination and trying to keep up with the changes that are happening almost day to day. Slow down a little bit, but sometimes it's still day to day. And then we have our vaccine management, where we are accounting for and monitoring that vaccine. And then we are going to add a new structure to our team that's called the Vaccine Provider Support Team. So we're going to talk about that a little bit more in just a few minutes. So overall, what the section does or what our focus is as a team is to just make sure that providers that want to supply vaccines through the Idaho Immunization Program are enrolled. They receive the tools and trainings that they need. They're in compliance with the different federal and state programs. We work on program improvement, which is basically how to get kids vaccinated on time or to get kids caught up. And then we work the vaccine management section like we talked about, and then obviously trying to support you as providers the best way that we can. So I'd like to start out by talking a little bit more about the Vaccines for Children program. So as most of you know, the Vaccines for Children program is an entitlement program so that eligible children 0 through 18 years of age can receive vaccines at no cost through an enrolled provider. In Idaho, we are fortunate enough to have what we call a universal program, where we also have a state-funded program called the Idaho Immunization Assessment, where health insurance carriers pay a fee into the Idaho Department of Insurance, and that funding is used to provide vaccines to children who have health insurance. So that allows you as providers to just have one stock of vaccine in your refrigerator. And as kids come in, as long as you are documenting their eligibility, which program they're eligible for, you can use that vaccine supplied by the state to vaccinate those kids. And you don't have to keep separate stocks and supplies depending on what someone's eligibility is when they come into the office. So I want to talk a little bit about the eligibility. So first we have our VFC eligible kids. And that is the federal program that we are required to review and document what their eligibility status is. So those kids could be enrolled in Medicaid. They could have no health insurance coverage at all. It's children who are American Indian or Alaska Native if they choose to participate in the program. And then our underinsured population, which we're going to talk about that one a little bit more because I think it offers a little bit of confusion sometimes on what that means. So all of those kids are eligible and can receive that vaccine that's coming to you from the Idaho Immunization Program. Then our next group of kids are what we call VFC ineligible, but they can still get state vaccine. And those are Idaho and Washington children with health insurance coverage for vaccines. And they're funded through that vaccine assessment that I mentioned earlier. So they also can receive the vaccines that are provided by the Idaho Immunization Program. Then there's the group of kids who live outside of Idaho or Washington and are not VFC eligible. Those children cannot receive the vaccines that are supplied through the immunization program. Those kids would have to receive vaccine that has been privately purchased by your office or facility. And for the most part, the clinics that run into this situation or see these kids are sometimes those children or those of you that are in more border type towns. So you have maybe some smaller towns in Nevada or Utah or Wyoming that come over to your clinics because you are actually the closest service, and then you're the doctor or the physician, the medical care that they receive. If those kids come over and they do have health insurance, they're not eligible for those vaccines that we supply. And it regardless of, so to be clear too, because I think this gets confusing a little bit, it's about where the child lives, not where the insurance is from. So that is something the assessment takes care of, and so you don't have to worry about whether they have Blue Cross of Idaho or Blue Cross of Michigan or that part doesn't matter. It's actually where the child resides is your determining factor for those kids. Washington is included for Idaho because they do participate in our vaccine assessment. So they actually pay funding in for those kids that reside in Washington and get vaccinated in Idaho to cover that cost of vaccine. So that's why they're included in this process. So I want to talk about the underinsured, and some of you have probably seen this slide before, but it works for me, so I hope it works for you. But basically what you're talking about is kids who have coverage. So in this situation, the coverage is represented by the umbrella, but the coverage doesn't actually provide any protection. So a child who has health insurance, but it does not cover the cost of a vaccine, that is an underinsured child. A child who has health insurance, but it doesn't cover the cost of all of the vaccines. It only offers some coverage or some protection. The vaccines that are not covered would make that child underinsured. And then finally, there's some vaccine or some coverage that you have a little bit of protection, but there's a limit. So it'll only cover so much, and then you're not covered anymore. So it has like a fixed dollar or a cap. So it might only cover $300 in vaccine costs, and after that, there's not a health insurance benefit. And that makes that child underinsured. So just want you to remember too that underinsured children can only be vaccinated at federally qualified healthcare centers, rural healthcare clinics, or one of your local public health departments. So if you actually are seeing underinsured children, you need to let them know that the vaccine is free at one of those other locations. Excuse me. The other thing to remember is the VFC eligibility documentation. So as a reminder, that documentation and that review of their eligibility has to happen at every single immunization encounter. And the reason that needs to happen is because a patient's status might change. Sometimes when an infant is born, they might start out, they're a Medicaid patient for the first few months of their life. And then something happens, and when you see them for their 6-month visit, they now have health insurance. So it's really important that you are taking the time to review and look at that information, and then it's documented at every visit. Because I know you're looking at the information, right? Because we're doing billing. And so we're documenting that information whether they have insurance or what their status is, like how is that vaccine going to be paid for. So what you just have to make sure you're doing is also documenting that eligibility at every visit. And then what you have to also do is make sure that's in the patient's medical record. So that is part of a medical record that needs to be kept in your office. And this is a good time to remind you that IRIS is not a medical record. Okay, IRIS is a place where we store information, and that information does have to be recorded in IRIS or documented in IRIS. But really, it really goes back to it's got to be in their medical record. So when one of the immunization program staff come out and do a visit and they review records and look at that information, they need to see it there in your office. Like they're not going to go to IRIS and check it in IRIS. They need to see it in your office and in your medical records because that's the federal requirement of the program. Okay, next, one of all of our favorite tasks that I just want to offer a reminder about, and that is temperature review. Storage and handling of vaccine is so important because there is so much work that goes into this program, and I know how much work you guys do. And one of the key things is to make sure that vaccine is viable and stored appropriately, because if it's not, it doesn't matter all the work we did, all the recall we did, all the education we did, all of the days we watch the temperatures. If we administer compromised vaccine that's not going to offer protection to those children, we kind of have not done what we intended to do. They sort of mess things up. So one of the ways that we are trying to help that and to make sure that temperatures are looking good is through the requirement of downloading the temperatures each month. So each month by the 7th of the month, you need to download the temperatures for the previous month. Then you need to review those temperatures. So what we're finding is some of you are sending us files and they are being reviewed, and we're finding out of range temperatures in times when the probe has been unhooked from the device for long periods of time. And so you guys need to make sure you're reviewing and looking at that information before you send it to us, that you're watching what's happening with your refrigerator, and then sending those temperatures to us and sending us those files. So what happens if you do review those temperatures and you find that something has gone on or it's been out of range? Well, please remember that anytime that you encounter out of range temperatures, they need to be reported to the immunization program. And that is through IRIS, through the Vaccine Temperature Incident or Alarm Report that you can find on the Related Links tab. This includes sensor disconnects, out of range temperatures, watch your cumulative temperatures when you're looking at your files. And then also for those of you who use PharmaWatch, we're finding more and more that PharmaWatch alarms are not being cleared. And so when those temperatures are being reviewed or looked at, it's showing that there's an alarm or a situation in an office that's potentially been resolved and taken care of. So if you guys would make sure you would clear those out after they've been reported and everything is okay, then please do so. We would appreciate it. So next, just as a heads up, I'm sure many of you have noticed that your FridgeTag 2L devices have a calibration date that expires this summer, many of them in July, in fact. Just know that we will be distributing new devices before the calibration expires. And so you will see those devices probably coming through the mail. We like to come and install those ourselves if we can and help you out with that task. So we'll see what happens. We remain hopeful that more and more we can get out and actually get into the offices and see you guys and do less of this virtual information sharing and less of the virtual site visits. So please watch those devices too, because the batteries cannot be replaced. And so we found the last time we went through this process is as we get closer to that 2-year mark, sometimes you'll get battery low indicators and just kind of watch, and hopefully we'll get them all replaced before those batteries actually expire. But the good news is last time I don't know we encountered a lot of that. So know that new devices are on their way. Next, just because of everything that's happened over the past couple of years, all of the extra work and focus that's been done with COVID, all of the virtual meetings, everything that you guys have been going through, just trying to take care of patients and being short-staffed and all of the I don't want to call it crazy, but sometimes it feels that way. Everything that everybody's been balancing, we have not been able to conduct all of the site visits that we typically do. And so I just wanted to remind you that it's a requirement of the federal program that all of the primary and or backup coordinators in each of the offices complete an annual training. So typically that is taken care of through site visits. You either participate in a VFC compliance visit with the immunization program, or you participate in an education visit with your local public health department. And so many of those visits are behind or have not been conducted. And so if you have not received a visit in the past 12 months, the final way that you can actually meet your training requirement is to go to the CDC's You Call the Shots and complete the modules for the Vaccines for Children program and then the vaccine storage and handling module. And then there is a certificate that you can download and print or save electronically, either way, to have record of completing those modules. So just think about that. If you have not had that opportunity for a visit, that you might want to take a few minutes and get that training completed and have that requirement met for your office. One of the places you can also document that after you've completed that training is in your vaccine management plan. So please remember, it is a requirement to have a vaccine management plan in your office that just goes over the routine operating procedures. When do you order? Who receives vaccine shipments when they come in? What happens in an emergency if your refrigerator dies? Who do you call to come and fix it? All of that information is supposed to be included in your vaccine management plan. So the vaccine management plan template, which is the front page is what you see here on the screen, has actually been updated by the immunization program and will be posted and distributed out through an email here, or a link to it in an email here in the next couple of weeks. So now is a great time. If you haven't updated it for a while, you could update to the new template. Please remember that you are required to review and update that management plan at least once a year or whenever you have a change. So if you have a new coordinator, if you buy a new refrigerator, if you update where your supplies are kept, that's just some of the stuff that needs to be updated and in this plan and documented. And part of the reason we do that is because a lot of times when something happens, the person that knows the plan, like in their head and knows what to do, is not available. So it's somebody else that's like, oh my goodness, this needs to happen. What exactly do I do? And this plan just helps with that. It helps go, oh, okay, here's where my supplies are, or here's the person we call when the refrigerator dies. So it's good information to have, and it helps us maintain our vaccine program. Wanted to talk about contact updates just a little bit because I will say that it has gotten confusing, I think, for all of us. But if you have a change in contact, either for the Vaccines for Children program or the COVID vaccination program, so if you're enrolled in both, there's some things that are the same, there's some things that are different. So regardless of how you need to, which program you might need to change contacts for, you always log into IRIS first. And then you will go to Manage Provider Profile or Provider Profile under VFC re-enrollment for the Vaccines for Children program. So if that is the contact information you need to change, if you need to change contacts for the COVID vaccination program, you'll go to the Related Links tab in IRIS and you'll complete the COVID organization or location contact changes form. And then there's going to be some follow-up with that because that will impact your provider agreement. And so you might have some additional follow-up there. You'll update the information, you'll click save. It will come to us and we will update systems. It does take a couple of days to get all of the systems updated and processed through. You share that information with us, we share that information with CDC, and that potentially then feeds to the ordering systems. So just as a reminder, and I think the problem that we run into and some of the concern is that the way that the federal systems are set up, your COVID, if you're dually enrolled, your COVID primary coordinator is who CDC considers the point of contact for all of your vaccine recordings shipments, communication, distribution. So if you make any changes to that COVID coordinator, that's really the person that's going to get the majority of the contacts. I say that because there are VFC providers that go in and make changes in IRIS. And I will tell you, when you do that, you override your COVID information. So the immunization program still strongly encourages you to have one single primary vaccine coordinator for both of those programs. And that way, even if it just keeps everything in line and kind of smooth running. And I know for some of those larger organizations, that's not even possible. So I understand that, but I just kind of want to explain it to you because it does get a little bit complicated the way the federal systems are set up. So if you did have to make a change to your provider profile as a VFC provider, just wanted to let you know that the provider profile is actually being updated. So you will see an updated provider profile is already posted online. So if you're a new provider signing up for the program, you're using the new profile. However, as a VFC enrolled and already participating provider, it will be updated in IRIS within the next 4 to 6 weeks. You will see that updated profile. So basically, CDC has just expanded some of the information that they want to know. They have changed the provider types a little bit, and they've added some questions like, are you part of a hospital system? Does your organization have a mobile unit? I think just some new information and things that are being considered now that we have COVID has probably taught us some lessons. And I think that there'll be some changes and some updates as we prepare and hopefully don't go through this again. But as we start to update and look at systems to try to be more prepared for the next time we encounter a situation like this. So the good news is that we are not doing VFC provider re-enrollment in 2022. You will see the word anticipated there because if COVID has taught me anything, it's that things can change. But at this moment, I do not anticipate any changes to the VFC program. And we did just do re-enrollment in September. So no VFC re-enrollment this year. But we will be asking that you do complete this new provider profile. So mid-May, around mid-May, toward the end of May, we will send out communication and ask you to go in and just update this information in IRIS, and more communication to come on that. But it really should be, it's a pretty simple process because most of the information is going to be in IRIS. You're going to answer a couple additional questions and then just submit that verification. Finally, then, as part of our VFC program, we work with what we call IQIP. So many of you have participated in IQIP visits. That stands for Immunization Quality Improvement for Providers. And really what it is just an opportunity for us to work with you on strategies to increase your on-time vaccination of children and adolescents. We know that on-time is not something that's definitely been a challenge over the past couple of years. So we get that and understand that. And right now we're really kind of focusing on catch up and making sure that those kids that missed any opportunities are getting those vaccines that are recommended for them. So thank you all. There have been quite a few of you who have continued to participate in those visits over the past year and a half, and we appreciate that. So just kind of to give you a heads up about where we are, just so you sort of have an idea. There are just over 22,000 2-year-olds in the state of Idaho, according to the 2021 vital statistics information. And of those kids, the CDC's and National Immunization Survey says that just over 72% of those kids are up to date with what we call the 7 series or the primary series, which is 4 DTaP, 3 polio, 1 MMR, 3 Hib, 3 hepatitis B, 1 varicella, and 4 pneumococcal. So that's what our coverage looks like right now to protect those kids. It's not a bad number. It looks okay. It's good for Idaho. But we also know that's our 2-year-olds. So these are the kids, and this number is prior to the pandemic. So what we're going to see going forward might look a little bit different. And I think we just really go back to focusing on and trying to make sure that we have kids caught up. Just as a heads up, the catch-up schedule is part of the new 2022, as always, but is part of the new 2022 childhood and adolescent immunization schedule. There has also been a new edition of the Pink Book published. And earlier this week, a copy of both of those was shipped to each VFC provider who is currently enrolled in the program. So if you haven't received those yet, you should receive those sometime next week. So those are for you to use in your office. There will be additional copies of the schedule available for ordering. However, there is, not at the moment, any additional copies of the Pink Book. So that's one copy for your office to share with everyone. So I want to talk a little bit about the COVID-19 vaccination program. Just a couple quick updates. I just want to point out, if you are a provider enrolled in the COVID program, that many of you signed provider enrollment agreements a year and a half ago. So you looked at that information, you kind of know what the requirements are, and we really don't go back to it. Once in a while, we send out hey, remember, this is a requirement. But I did want you to know that the CDC does have a website that lists the requirements, or if they make an addendum or a change to requirements. And so it is posted on the website, and it is something that you've agreed to follow by signing that original document. So just want you to know it's out there. And as a reminder, I just wanted to talk about administration fees for a second. So many of you know that the HRSA program ended on April 5th, and that was to help pay for cost of vaccine for those who were underinsured. Regardless of the ending of that program and the ending of the capacity grant program here in Idaho, you are still required to administer COVID vaccine at no out-of-pocket cost to the recipient. So just kind of want to point that out. We have gotten some questions. We've been asked now that that's not available, do we have to vaccinate people? And that really, that is still a requirement to vaccinate at no out-of-pocket cost. So just kind of wanted to put that reminder out there. The other thing that is actually some good news, I think, if you're a COVID provider, you previously had to submit inventory on a daily basis. But beginning on May 1st, the CDC has changed that requirement, and COVID inventory only has to be submitted at least once a week by close of business on Fridays. So that is some good news. A little bit less work there on the horizon. The other piece of information I just want to point out and to make sure that you are aware of is the CDC's interim clinical guidance for the use of COVID-19 vaccine. So anytime there is a change in information or recommendation, we try to send that information out through our program and let you know. But also, those changes are always updated and posted on this webpage. And it has good information. If you have not seen it, they provide a recommended schedule and a little table that's fairly easy to follow. And then there's a separate one for someone who might be immunocompromised. And I think they're just good resources to try to keep up with the recommendations that change or the guidelines that change. I just really want you to be aware of this because we get a lot of questions, and as a team, this is where we get our information, and this is where we try to share information so that you have that. So also know it's available for you to get a hold of. Next, we will send out some communication, but I just wanted to make sure you were aware of, if you had not heard, that recently both Janssen and the Pfizer Tryst formulation of COVID vaccine have received approval for shelf life extension. So basically the expiration dates have been extended. So Janssen has gone from 9 months to 11 months, as long as you've stored it in the refrigerator at appropriate temperatures. And then the Pfizer Tryst, so the gray cap and the orange cap, have been changed from 9 months to 12 months, as long as they have been stored at the appropriate frozen temperatures. So remember, orange cap is in a standard freezer, gray cap at the ultra cold. So they can be around a little longer. The expiration dates for Janssen have been updated in IRIS, and for the Pfizer BioNTech will be updated by the end of the day. And then always just make sure you're using those manufacturer websites to verify and check expiration dates. And just so you know, if you happen to have any of the Moderna 14s left in your office, those should be expired, and you should go ahead and report that waste and dispose of those doses. So what's next for COVID? Who knows? No. So get this question a lot. When is COVID going to just be part of the routine vaccines? We don't know for sure. CDC and the federal government really don't know for sure. They are discussing it and talking about it now. We anticipate sometime toward the beginning of next year, end of this calendar year, beginning of next year, we will see some changes, but we will continue to communicate those as they come along. We can make assumptions that the vaccine will receive FDA approval and it will become part of the Vaccines for Children program. I don't know what it looks like for the adults, but there's a lot of talk about support for adult programs, adult underinsured vaccination programs. So I think that another one of the benefits from COVID is really having a focus on adults and what do they need and how can we support them through the immunizations they need. So I think we'll see some changes there, and at least from our standpoint, from an immunization program, we've had pretty limited resources for adult vaccines. So I'm excited to see where that goes and what we can do with that. There are pediatric vaccines that we anticipate seeing this year. So those would be for children under 6, for the Moderna product, and for then 6 months to 4 years for the Pfizer product. At this time, today, the CDC is saying that they anticipate mid to late May is when the data will be submitted to the appropriate committees for review by the governing bodies. And then we should receive or see an approval potentially and a recommendation. And then anticipation for those doses to be available in the state in June. So that's the timeline that's being discussed right now. As we know, I will state it again, with all things COVID, it kind of changes, but we do think that's coming. So we should see that vaccine. As far as the immunization program goes, the other thing that we will see or that we hope to see soon and what we are working on is direct ordering of COVID vaccine through IRIS. So right now, you are still working with your local health department and submitting orders through them to us. And our goal is to work on just getting that directly through IRIS, and you can order that vaccine. And part of the reason we haven't just completely changed that is just we still have some large quantities. So for example, if you need the Pfizer adult formulation in the gray cap, it's a 300 dose minimum order quantity. And sometimes you just don't really need 300 doses. And so working with your health department to get smaller quantities has been a huge benefit. Vaccine management. And it looks like I need to talk faster. Okay, so I want to talk to you a little bit about vaccine management. So I just want to show you over the past 5 years, the amount of money that Idaho spends just on vaccine, anywhere from 35 million to 43 million, closer to 44. It's an average of about $40 million a year on vaccine. And that is one of the reasons that we really are focused on inventory and accountability, making sure that we are doing our due diligence to take care of that vaccine and that we are spending funds appropriately. So we have encountered quite a few providers who are having inventory issues. And we just wanted to remind you about the inventory not deducted functionality in the registry. It's located under the inventory section in the menu. Everyone who can manage anything with inventory. So if you can order a vaccine, you have access to this screen. And so it basically, who it works for is for those providers who have an electronic data exchange. So there's a message that goes from your record system to IRIS so that those immunizations transfer over into the registry. And for some reason, they don't deduct from inventory. So to be clear, IRIS's function is to store immunization records, right? Schools use it, child care providers use it, kids who are going to college, who are going into health fields. There's people that need copies of those records. So regardless of whether it deducts from your inventory or not, that information still goes into the registry. So if it doesn't deduct from the inventory for some reason, it's going to show up on this report. And this is kind of a piece together, so you can adjust your screen. But it will give you all of the information about a vaccine, and you can actually go in here and if you can correct it, you actually can click a checkbox and click save, and it will deduct it from your inventory. So the immunization is in IRIS. It's in the patient record where it needs to be because that's the goal. But now you can go ahead and account for it in your inventory to help meet the requirements of the program. There is a resource posted on our website. If you're familiar with the immunization VFC provider binder, it is out there, and there is a document that will walk you through how to use the inventory non-deduct module. But you're going to find some things that are sometimes pretty simple to take care of. And a lot of it is just a mistype. So for example, in this Gardasil up here at the top, someone put the letter O when the lot number was actually a 0. And so just by going, oh, this lot number was entered wrong, I can select this lot from my inventory and click this checkbox, click save, and now it's deducted and accounted for appropriately. You have something similar with this flu mist. So it matches exactly the same. So there's something happened that it didn't deduct. Maybe it wasn't in your inventory prior to being sent by an electronic file. Okay, so you can go ahead and deduct it. You've sometimes got people forget unit of use versus unit of sale. So remember that the immunization program follows the federal program, and we do all of our inventory on the packaging. So whatever the lot number is on the packaging is the lot number information that you're going to see in IRIS right now. So sometimes that's where your discrepancy is. This is a unit of use, so it was actually administered, versus a unit of sale, which is a package lot number. Also easy to check a box and get it to deduct. This situation is a little more complicated. So when you're finding lot numbers that might not be correct, you'll have patient information actually right here that you can't see on my screen, but you will be able to see in IRIS, and you can go and research and make those corrections as to what vaccine was actually administered to those patients and get that deducted from your inventory. So it's a really good tool, and I hope that you take some time to get familiar with it and use it a little bit. Next, I know that you all were surprised on April Fool's Day when we updated the managed transfer screen. I am hoping that it is easier to use as you get familiar with it. It does offer a lot more information than the previous screens did. Do want to remind you, because the new screens, as we are transitioning in IRIS to the new look, which is the look that has the blue banner across the top and down the side, that you sometimes need to scroll to be able to review these icons over here at the end. So that really is one of the things that we've gotten some feedback about, and it's just a reminder to just scroll over so that you can see your packing slip and your shipping file when you need to. Finally, just so that you know, we are working on it, and hopefully you will see it by the end of the summer, is the doses administered not from inventory. Once again, this is a mock-up screen, so don't adjust. It's not going to straighten itself out. But basically what we are doing is right now, if you administer a dose of vaccine and it's not in your inventory because you didn't get it from the immunization program, you have to enter that as historical. So you'll no longer have to do that. There will actually be a column that you can put doses in that are from another inventory. So this will especially impact if you do manual entry and vaccinate adults, for example, and you don't want to put your privately purchased information into the registry. So you'll be able to just add that information here. So we are working on that and hope you see that one pretty soon. The next thing I just wanted to give you a heads up about is about the meningococcal conjugate vaccines. There are going to be some changes in supply. Sanofi will be transitioning to just supplying the Menquafi vaccine and not the Menactra. That is going to happen sometime this year. We don't have a timeline because it just really depends on the supply that's already out in offices across the United States. But that transition will happen. there's all of the scheduling is the same for the vaccines. So you're really not going to see a big, huge change there, but just know we will be sending out some communication if your office is one that uses Menactra. We will eventually transition to either the Menbio or the Menquafi, and you can update your brand choice as always using your brand choice form in Iris. And then just remembering that changes now would not go into effect until July 1st. And then typically it would be January 1st. This is a situation that's different. If supply changes and the vaccine is no longer available, then that brand choice would go into effect immediately. And then finally, I just wanted to talk to you just a little bit. We have a new branch of our section that we are going to be implementing that will solely be focused on supporting you and answering some questions, kind of a help desk. So basically, we are transitioning. It's going to be a new process, so there's more information to come. But our goal in all of this is to make it easier for you guys and to get you support quicker. And so that's really what we're focusing on and trying to do. I'm excited about it, and I think it will be really helpful for all of you. And like I said, more information to come on that one, but it is something we're implementing. So thank you. I think I went over just a little bit, but if you have questions, if we get down to the end and we have a few minutes, I will be happy to answer. But for now, I'm going to go ahead and turn it over to Gwen Baker, our IRIS manager.
Morning, everybody. Can you hear me all right?
Yes, we can.
Yes.
Okay, thank you. So, howdy, everyone. My name is Gwen Baker. I took over as the Immunization Registry Manager for the Idaho Immunization Program in August of last year. It's been a pretty wild ride with all the changes and all the growth that we're going through right now. And let's get you all caught up a little bit on that. Next slide, please. So IRIS is Idaho's immunization registry. The immunization program maintains IRIS, and it's a secure health information system containing the names and immunization history of people who received vaccinations in Idaho. IRIS helps remind patients and their parents when immunizations are needed, provides patients with a permanent immunization record to help reduce unnecessary immunizations, and saves healthcare providers time when requesting patient records. The information in IRIS is available only to authorized healthcare providers, child care providers, and schools. Next slide, please. So a little bit of history. IRIS first went live back in 2001. Our original platform was hosted by STC, and we migrated to our current platform in March of 2012. So IRIS is now 10 years old. And our vendor supporting us is Gainwell Technologies. They've been through quite a bit of transformation as HP, and former pieces of it have kind of broken apart and moved around a bit. Next slide, please. So the IIS section here is basically broken into 4 teams. The help desk, who most of you may be familiar with already, who assist users, do a lot of password resets and that kind of thing. They follow up on data quality issues, and of course there's been a lot more activity there since the volume of data has increased exponentially with COVID, and the demands put upon the data by decision makers have increased. We also have school and child care, reporting and analytics, again, providing data to those decision makers, and data exchange, establishing and maintaining data connections with your electronic medical systems. Next slide, please. So the IRIS Help Desk has gone through a lot of growth in the past 2 years. In fact, 2 years ago, it was basically one person. Right now, our lead is Lisa Murphy. She does a fantastic job of training new folks and coordinating everyone's activities. She brings a lot of awesome energy. And I'm sure a lot of you have already had contact with her and know just how great she is at what she does. Ruth Okpara has joined us. She's a CDC Foundation assignee, and she's doing a great job helping Lisa. And the other folks in this list, Jackie Madriaga, Maria Alanis, Nikki Laverne, Sun Ying Wong, Peyton Fouch, Sherry Murray, and Jelani Bunn are our help desk staff. They are the people who pick up your emails when you need help, who reach out to you about data quality issues. And I really think we've got a great team who do a fantastic job of collaborating and supporting everyone they deal with. Next slide, please. For data exchange, we have another newish team member, Bamir Karamrich. He's our data quality and interoperability coordinator, and he's the all things data exchange guy. Our school and child care coordinator is Emily Doris. She has a great depth of experience and also acts as a consultant for the help desk. Next slide, please. And then we have our reporting and analytics team, Rebecca Stage, Ryan Huffman, Randall Tran, and Julia Gancher. These are our database nerds. They are fantastic people. They can make the data dance and pirouette if you need it to. And they're really bringing a lot of value these days with all the information that our decision makers need. Next slide, please. So here's a little demonstration of how data has grown in the era of COVID. This is month by month levels of immunization record submissions. And when we get down to the end of 2020 and beginning of 2021, you see a great big spike. And that has really blown up the size of our database. And the number of records we're getting per day, per month is truly unprecedented. Next slide, please. Even more staggering is the number of people who've been added to the database, as so many of us have gotten our adult vaccinations. And you can see this great big spike on the right-hand side. Again, that's a lot of data entering in a very short period of time. Next slide, please. So our vendor, Gainwell Technologies, we have had them incredibly busy rolling out updates and new functionality. The Manage Edit Transfer that dropped recently. They've been establishing new data reporting connections. We have established a data warehouse within IDHW's network to enable better reporting for our decision makers and for our dashboards. And we've implemented continuous improvement. A lot of vaccines have been added, a lot of new products, new combinations, and we have gotten a lot of changes in place that improve our pandemic readiness for the day when this inevitably happens again. Next slide, please. Currently, we have Gainwell building a school immunization report module. That's something we're pretty excited about, so that the school users will be able to just log into IRIS and do all the work right there. We're currently managing migrating our hosting platform to an AWS environment for improved availability, performance, and security. We're working on data exchange with VHA to pull in immunization records from Idaho's VA facilities. The VA has gone through a lot of growth in the past few years. They've established a lot of smaller clinics, so it's more than just the Boise VAMC now. We have clinics associated with VAMCs in Washington and Utah as well. And we're working on a consumer access solution so that people will be able to download an app and pull down a full immunization history onto their phone. And that's really going to make things a lot easier for people who need to demonstrate their vaccination status for travel or their kids' vaccination for school and stuff like that. It's been a long time coming. My predecessors have been fighting the good fight for many years, and we are finally bringing it to fruition. Next slide, please. Planned projects we have include child immunization coverage dashboards, school immunization report dashboards, and an updated look and feel that you see in some of our pages in IRIS today and will eventually be coming to the entire site. Next slide, please. And now I will turn it back over. Thank you very much.
Thank you, Gwen. As always, Shot Smarts would not be complete without recognizing some of you who have continued, especially through these challenging times, to make sure kids are up to date and getting the vaccinations that they need. So this year's Immunization Coverage Awards looked at vaccinations received during calendar year 2021 and have been awarded to organizations who have met the goals listed there on the screen. So a 90% or greater for 4 doses of DTaP on time. So remember, these are on-time vaccinations. 1 MMR at 90.8, the primary series at 80% or greater, up-to-date HPV at 13 years of age, 80% or greater, and up-to-date, actually that should be 2 doses, so I apologize, 2 doses of meningococcal conjugate at 17 years of age, 80% or greater. So these slides are going to slowly be scrolling through, but we do have a few minutes if there are some questions. If Marin or Megan, if you guys would like to help me out, as I can't see the chat or anyone's hand.
We have some questions. A couple of questions have been answered in the chat, but some that have not. One is, would you like us to order a MenQuad fee or Menactra?
I do not have a preference on what you are ordering right now. So that is still your decision, and both vaccines are still available. Mostly I just want you to have the heads up to let you know that there is going to be a change at some point during the year. But for now, both vaccines are available, and you may order. You can pick one or the other and make that choice right now.
Okay, thank you. And then we have a couple of questions regarding vaccine management. So first, when managing transfers in IRIS, it does not show how many you have pending until you click on the tab. For example, I received 8 transfers in the last couple of days, and it did not show that until I clicked on the inbound tab. Will this function be updated to show the actual number by the name of the tab, or should staff be expected to click on it first?
So that sounds to me like a bug. So it should be showing that information. We have talked to our vendor about some of the delays that we are seeing in those transfers. And so we will make sure we bring that to their attention. But thank you for pointing that out to us.
Okay, great. And then next, with the new function of entering historical vaccines not from our inventory, will there be a way to enter multiples at once as it is right now?
If I'm understanding the question correctly, then yes. So you would be able to go to that. It's going to be basically the same thing you're doing right now. Well, no, let me rephrase. No, it's not going to be like historical. So you're going to go to your immunization screen and you'll do the check boxes. So it's not going to be like historical where you go to say DTaP and you could click in 3 and you can enter 3 historical doses at once. It will be more like if you're adding vaccine from inventory at this moment. It is still under development. So that is something for us to consider as we go forward with this process.
Okay, thank you. Also, just an FYI, the transfers tab is taking a while to load. Oh, sorry, Susie already answered that. Thank you. For the yearly training, does the CDC training for COVID vaccine administration and handling count, or do we also need to do the VFC specific?
So the training that I did talk about today is VFC specific. So that is and has been for a long time an annual requirement for primary and backup coordinators. So the training that I discussed today was really specific to VFC. If you're a COVID provider, there is currently not a requirement for annual training. So, and that may evolve, but right now the training needed to or should have happened when you enrolled in the program. And if you had not for some reason completed that training, then I suggest please visiting the Idaho COVID vaccine providers website and going to enrollment, and there's a list of the required trainings there.
Okay, thank you. Next is, will we eventually have to make a brain choice between Vaxelis and Pediarix?
Not at this time. Eventually, I don't know. At this point, we're seeing that as not being something that's brand choice as we transition and then this new vaccine becomes available. But who knows what happens in the future. I will go back to COVID has taught me not to get too comfortable with anything. So at this point, we do not have plans to make it part of brand choice. Vaxelis will remain something you can just order.
Okay, and that I believe is all the questions that I am seeing in the chat. Megan, do we have any hands raised?
Hi, Marin. I don't see any hand raises at this time. I'm just scrolling through and I don't see any.
Okay. Well, then everyone enjoy and hopefully seeing your clinic up on these slides. And I'll let those run for a minute. that was a lot of awards, which is really exciting, especially after the couple years that we've all been having. So I'm just going to say now, thank you again, everyone, for joining us this year. Recordings, slides, evaluations, and then any additional information that we discussed we would share with you during the presentations will be sent out in an email, hopefully early next week. And just a final thank you to you all, and we hope to see you all in person in the fall. Have a great weekend, everybody. Thank you.